Welcome to tonight's webinar. My name is Jocelyn Williams. I will be your host. I am the founder and director of Neurolly Solutions. You have joined us tonight for our Indie Birth Alliance Summer 2020 Education Series, and we are just so excited to have you with us. Our series takes place each Monday night, 8 p.m. Eastern Standard Time. We started August 3rd, and we're going to continue through to about the first week in October. So it's just a jam-packed full series. Some of the topics that we have talked about or that we will be talking about have included breastfeeding support, doula services, fertility coaching, pelvic floor physical therapy, postpartum care, spinning babies, VBAC, the infant developmental sequence, and more. So who exactly are the IBA? The IBA is the Indie Birth Alliance, and we are a group of birth and infant professionals empowering a healthy birth community through support, service, education, and advocacy. We want you to know we've got your back. Tonight's guest speakers are Dr. Amy Robinson and Dr. Julia Powden. They are both pelvic floor physical therapists. Amy founded Restore Your Core Physical Therapy 4 years ago and has been practicing for 24 years. And you would never know that because she does not. She just looks so beautiful and young. Julia joined Amy last October and has 5 years in the field. As a team, their goal is to treat patients holistically and to give them the care that they would want for their own family. Amy and Julia have a mission to help the women of Indianapolis optimize their pregnancy, delivery, and postpartum period. So to learn more about them, I just want to encourage you to check them out at www.restoreyourcorept.com. Tonight's event is entitled Pelvic Physical Therapy. What is it and why all moms need an assessment? The topic is certified pelvic physical therapists that are here with us, Dr. Amy and Dr. Julia, will explain the many issues moms face during pregnancy and the postpartum period and how pelvic physical therapists can help. So without any further ado, first I want to say welcome, Dr. Amy and Dr. Julia. It's just an honor to have you with us, and thank you for giving up your time for free to volunteer your professional time to speak to us tonight. We truly appreciate it. Before we dive into our questions and answers, and by the way, let me just slip in here to kind of give you an agenda for tonight. The way the evening will work is we'll have a question and answer period with our doctors that are on with us tonight. Then we will have a very brief discussion about the infant developmental sequence. And then if time allows, we'll open it up for questions and answers from our participants tonight. So before we dive into all of that, Dr. Amy and Dr. Julia, can you tell us, why are you so passionate about pelvic PT, and what inspired you to seek out this field? There are many other professions you could have turned to, but pelvic PT, why so? In fact, I had never heard of it until I met you, and I'm so glad that I met you. Could you speak to that to us tonight?
Sure. I'll start by saying thank you so much for having us. We're really happy to be here. I have to say that I originally went to physical therapy school thinking that I was going to work with clients who had suffered strokes because I grew up watching my grandfather go through that. But I had a 45-minute lecture in physical therapy school on pelvic physical therapy, and I thought it was just really neat, although walking away from that lecture, I thought, I don't think I can do this. I think that my classmates are going to think I'm nuts. And walking out of the lecture hall, a lot of my classmates were like, that lady's crazy. There's no way I would ever do anything like that. But my mom was actually an OB nurse. And so I grew up around it. I grew up hearing all the terminology. And then I always say God kept putting it in front of me. And so every step of the way, God put it in front of me, and I had a true calling. That's what I was supposed to be doing. And there's been twice that I thought maybe it was time to do something else, and God just gave clear messages each time that it's time to continue to do the work that He's put in front of me. So I love what I do.
I love that. Thank you for sharing that. Dr. Julia?
Yes, so I went in actually on the opposite side of Amy, as I really wanted to do sports orthopedics, and I had a sports injury myself, being a young athlete, and spent a lot of time in a physical therapy clinic, and I realized how much those PTs had helped me in my life, and I wanted to do the same thing. And so when I got into PT school, my first ever class was gross anatomy, where you dissect human cadavers. And I took a look at the pelvic floor, and I was like, oh my God, like, what is this? This is so cool. And unfortunately, my professor, who was a physician, said that doesn't matter. You don't need to know anything about it. And to me, when someone says I don't need to know anything about it, I do the opposite. And just like Amy, I have a mom who was a labor and delivery nurse and a stepdad who was an OBGYN. And so it all kind of clicked together that summer, my first, semester of PT school, that this is what I wanted to do. And so I've kind of dedicated all 5 years and really a lot of my student education to this population and helping this field. And I couldn't love it more.
Wow, that's awesome. Thank you for sharing that, Julia. So let's go ahead and dive in. What exactly is pelvic PT, also known as pelvic physical therapy?
So pelvic physical therapy really is just like other physical therapy when we come to looking at the whole human body, right? We're looking at bones and muscles and joints and connective tissue, but honestly, we really have specialized training in the area of the pelvis and the abdomen. Now, we do treat our patients holistically, but the specialized training comes in the area of the pelvis and the abdomen. You don't get it in physical therapy school, the education needed, unless you go on to do a residency. And there aren't very many residencies in the United States. And so I have been out for 24 years. So when I was out, there were no residencies. And actually my first mentor was in Hawaii. And so we did phone calls and email chats, but we have to go to continuing education courses to get the education that we need to do this kind of training. And we treat things such as urinary leaking, fecal incontinence, constipation, pain associated with periods, pelvic organ prolapse, low back pain, like sacroiliac joint dysfunction, and the list goes on and on and on of the many things that we can definitely help with. Unfortunately, in the United States, pelvic physical therapy is very much underutilized, and it is our personal opinion and belief that every woman that's going to have a pelvic or abdominal surgery should have one or two sessions of pelvic physical therapy prior to their surgery, and then follow up with however many sessions they need to rehab after their surgery. And the same goes with moms and having babies. So we believe that every mom should have a few sessions pre-conception and then additional sessions after they have their kiddos.
So I'm going to throw this question out there. Why?
Yes, so I think that's the big question. And for some reason in the United States, we are so far behind other countries. You go to France, you go to other countries, and they get like 6 to 10, if not more, visits of pelvic floor physical therapy that's guaranteed to them. Right? And for some reason in the United States, we haven't prioritized that as a country. And it's preventative health, right? It's getting your pelvic floor ready after having that baby to go back into the demands of life. And for some reason in our country, we haven't quite gotten to the path that we have with other surgeries. You have an ACL injury, you get a meniscal surgery, and they do prehab and they do rehab. Right? And that PT or that orthopedic surgeon is going to give you a referral for physical therapy. But for some reason, we haven't equated in our country having either a C-section or vaginal delivery to being enough trauma to get us that referral for PT, when in reality, it's sometimes even more trauma to our body than those basic surgeries that you can get for orthopedic concerns. And what we know is it can take 4 to 6 months for the pelvic floor to be able to fully heal from delivery. So all of the fascial connections, so fascia is a connective tissue in the pelvic floor, gets stretched. And it takes that long to truly get those tissues to heal. And so physical therapy on our end should be made to help that muscle rehab faster and regain its function more quickly. But we don't see it the same way as we think of rehabilitating the quad with an ACL surgery, right? We're all about rehabbing the quad after an ACL, but we don't think about the pelvic floor when it comes to our deliveries, unfortunately. And the other thing that we're far behind on as well is preconception physical therapy, which is also recommended in other countries.
So that begs to ask the question, why don't we offer a pelvic PT assessment to all moms in the United States?
So I do believe it's just, I think it's a lack of sometimes understanding, right, on the part of the physician and the general public. I also think it's also, especially in the state of Indiana, we did not have direct access to physical therapy until just about, I think it's been 7 years now, which meant that we relied on a physician to refer clients for therapy. And so it just was something that was totally missed. Now, I have to admit, I have been preaching this my entire career. And so I think we're slowly getting there. And when it comes to, looking at why we're not offering these things, I also think it's important that we start to offer this kind of thing pre-conception, right? So we want to get every single mom into our therapy clinic for 1 or 2 sessions before they ever try to start conceiving. And we want to do that because we want to really help those moms prepare. We really look at everything. We look at their breathing. We look at their alignment. We look at their hips. We look at their pelvic floor, their abdominal wall. That way, after they deliver, if there are any issues during the delivery process, we really have something to compare it to. So we know what their initial baseline was and how to help them work to get back there. I think the other thing with a pre-conception assessment that's super important for women who have fertility issues, infertility issues. How many women play sports? A lot of women play sports these days. Every one of us has had a fall. The ovaries sit very close to the hips. And so if you have any scar tissue or history of endometriosis or PCOS, all of those tissues need work on before you try to conceive. And so it's really important on our end that we can really help a lot of women in a lot of ways in a few sessions just by gaining a baseline, picking up on things that, maybe their physicians aren't typically looking at that we do look at. And so, from preconception then, we're looking at women all throughout the phases of pregnancy, but it's also very helpful for pelvic PTs to see women throughout their pregnancy, during their pregnancy.
Why is that? What can pelvic PT specifically help with?
Yeah, so during the pregnancy time span, your posture and core changes so drastically, right? You're growing this awesome fetus in your body, and your body is changing along with all the hormonal factors that play into it. And so the posture coupled with our core changing, coupled with hormonal impacts, means that we have a higher impact to have low back pain and sciatica and hip pain and pubic symphysis dysfunction, urinary leakage, all of those things. And so for us, we can, first of all, help you get out of pain, and then second, keep you active, which is going to give you and have you a very healthy pregnancy throughout it, right? And so if a mom isn't exercising at all, seeing a physical therapist is really great for us to get you started on a baseline program that's going to keep you healthy and strong while not putting you at risk throughout your pregnancy. And then on the spin of that, we also love to keep moms who are very into high exercise and impact things into their exercise program, right? And so we want to keep you healthy and fit. We want to keep your core going, right? We want to promote all of these things because we know if moms exercise and keep moving, they're going to have a healthier birth outcome and a healthier baby afterwards, right? And then at the same time, we can also help to promote improved delivery outcomes. We can teach moms how to utilize their pelvic floor to be able to push and lengthen effectively, right? Most women at that point have never had their pelvic floor assessed to know what a contraction means versus what is the lengthening or relaxation of the pelvic floor means. So when they get to the delivery room, to really know the difference is very, very difficult. And we can also teach moms how to perform perineal massage to be able to decrease tearing during their delivery as well. And so once you have that, right, and once you have your baby, there are so many things that we can do to help promote postpartum care as well.
So that's awesome. That is really, really awesome. I know I have 5 kiddos and 2 are biological, and I tell you, exercising was so helpful in preparation for giving birth. I didn't know about pelvic PT back then, wish I had, but I can attest to the fact that, you know, maintaining exercise. And one of the things I wanted to do was get back into exercising right away. And we have to be careful with that because sometimes if we're not healed up properly, we could actually prolong the healing process. And so can you help with that? Could you help with not necessarily speeding up the process, but ensuring that mom is healing properly? And what other problems can pelvic PTs help new moms solve in that postpartum period?
Sure. So we really are trying to make a very concerted effort to get the word out that every single mom, whether they're feeling good or not, should have a pelvic floor assessment once they give birth. And we usually say at the 6-week mark, because usually by then they're cleared. It doesn't mean we can't see them before that. But our goal in the postpartum phase is to help moms who are suffering from urinary leaking, fecal leaking, you know, pain with sitting, sometimes with perineal tearing, there's, you know, that painful scar. We help with painful intercourse. Once they're cleared at the 6-week mark, if they're having pain and the pain lasts past 2 or 3 attempts at intercourse, they need to come see pelvic PT. We very often can work that out very quickly. You know, we work a lot with pelvic pain, sacroiliac joint dysfunction, low back pain, hip pain, neck and shoulder pain. There are so many things that I think moms just think are normal because they very often are told that they're normal. You know, other women say to them, oh, don't worry about it, it'll get better. I have heard doctors say to moms, oh, you know, you're having babies, that's just the cost of having babies. But it's really not true. There are so many things that we can do to very easily help moms, usually within anywhere between 4 and 8 sessions, depending on what they're coming in for. So, you know, a big one for us is pelvic organ prolapse. You had mentioned, you know, wanting to get back into exercise. And so many moms, they go for their 6-week checkup and their doctor says, okay, you're cleared. And a lot of moms say, well, what can I do exercise-wise? And the doctor said, well, you're fine. Whatever you were doing before is fine. But what we always say to all the moms is very, very rarely does a doctor do a pelvic floor muscle examination on a new mom. Usually that 6-week visit is just to kind of sign off and say, yes, the tissues are healed from the delivery, whether it be a vaginal delivery or C-section, but they're not really assessing abdominal wall function and pelvic floor function. So it's super important because if you're a CrossFitter or a runner, anything that's high impact, especially if you're breastfeeding, there is an increased risk of prolapse. We're not saying that to scare anyone, but that's one of the phone calls that we often do get in clinic where women call us just panicked because they went out for their first run and now they're feeling pelvic pressure, right? And so if we can help women avoid that, we certainly will. And we do have a running assessment that we use that came out in March, I think it was March of 2019, and then they updated the guidelines. And we have been using that since it came out. So it really helps women understand if they're ready to transition into higher impact exercises. And so that's one of the things that we really look towards. I think that for us, high impact exercise, there's so many moms that don't know how to transition into high impact exercise. And we help them with that to do it safely and decrease their injuries.
That's super important because, and also some moms might feel like, oh, I can't get back to high impact exercising because I may have an injury, or I may not be able to nurse and I want to nurse. And if I do high impact exercise, that may decrease my milk supply. And I don't know if you could speak to that, because I know that's not necessarily your wheelhouse, but that's just something that came to my mind. And then a couple of things you touched on, and I'm thinking, wow, so it's really not okay for a mom to have to leak after having a baby or two. Like, something can be done about that. Like, most moms, you know, that even that I know, like, oh, I can't jump on a trampoline anymore. Are you kidding me? I can't even laugh too hard because I've had 3 or 4 babies, and I may have a little accident here. And so what I'm hearing from you is that that doesn't have to be the case.
Right. We do say that leaking is common, but not normal. And I actually just had a client say to me today, she's had 2 children and she leaks. And she said to me that her physician tested her pelvic floor muscle strength and told her to do Kegels, but didn't assess if she was doing them correctly. And actually her problem was she was holding too much tension in her pelvic floor muscles, which can make her appear weak, because it's almost like I tell people, it's like you're holding a fist and your pelvic floor muscles are tightly closed. So you can get a little bit of grip, so it feels weak when somebody's assessing it. But if you try to strengthen a pelvic floor that's already too tight, oftentimes you'll end up with pain. And then oftentimes the leaking will get worse. And so that's why a pelvic floor assessment is so important, because if you don't assess it, you're guessing at what the problem is. And so I say to all women that, you know, if you have a shoulder injury, you're going to have your physical therapist touch your shoulder and figure out what's going on with it. And the pelvic muscles are no different. And then the other question you asked was about milk supply. And that's why Julie and I, we are in a community full of like-minded women business professionals, and we would refer on to a lactation consultant to make sure that everything that needs to be happening there is happening, because that is definitely out of our wheelhouse. It is not our area of expertise, but we would hear that and we would actually refer them on, because it's an important issue to address.
And then,
I love that. I'm sorry.
Oh, you're good. I was just going to piggyback off of the fact that, you know, like you were saying, a lot of women say they don't feel like they can get back to those high impact things. And some of the clients that we see actually have gone to multiple different pelvic floor PTs, and they're like, well, I stopped leaking in my day-to-day activities, but I'm still leaking at those very high load and impact activities. And so I always ask them, well, did they have you actually train your pelvic floor within functional movement and within the activity that you want to get done? And so that's something that we are both very passionate about, is you can't just train the pelvic floor in isolation. You have to train it back into the skill that you're trying to get back into. And there's very graded exposure and load progressions that we take women through to be able to get that. You can't just say, okay, well, you can do it in standing, so you should be able to do a box jump or a double under just fine, even though you never trained it. And so the same goes for women that say, well, I'm never going to be able to do crunches again. You know, I have my diastasis recti. I'm never going to be able to do planks again. But what we know is if you teach someone to do it well and with the correct muscles, with the correct pressure and strategy, they usually can do it really, really well and can start to gain strength from that, versus just saying, hey, I'm never going to do abs ever again because someone told me I couldn't do that because I have a diastasis recti or because I have a prolapse. We get women to do those activities all the time and do it safely. You just have to be able to teach someone how to do that.
What is a prolapse for those that are not in the medical We've heard words like perennial tear and prolapse, and could you gently explain those?
Jocelyn, I just want to say that you're kind of, I don't know if your microphone moved, you got really muted in there.
How's that? Can you hear me now?
Good. I can hear what you were saying. You were asking about what prolapse is. Julia, do you want to answer that, or do you want me to answer that?
I'm going to let you go for it since I know this is your absolute favorite wheelhouse. So.
Well, it's not, you know, I have prolapse, so it's become my favorite wheelhouse. You know, I had a pelvic surgery, and so prolapse is where either your bladder, so your bladder can start to fall out through the vagina, and there are varying degrees, right? It's called a cystocele. The rectum can also start to fall out. It's called a rectocele. Uterus can kind of start to invert and fall out, so that's a uterine prolapse. And then if things are progressive, you can also have what's called an intracele, so the intestines kind of start to prolapse into the pelvis. And so they're graded 1 through 4. One really, I know they were talking about most women who've had a vaginal delivery. They were talking about American College of Obstetrics and Gynecologists. Every woman having a vaginal delivery was going to be graded automatically a grade 1 prolapse because, you know, there's movement that goes on down there. And most women don't feel a grade 1 prolapse. It's very little movement. To a grade 4, which is where the organ is completely outside of the body, which does require surgery. And I've had a couple, actually, family practice doctors refer clients who have a prolapse, and I go to do their pelvic assessment, and I lift the sheet up, and their bladder is on the table. And I'm like, okay, I can't help this. I can assess your pelvic floor, and we can make sure you're doing that right. So after the surgery, you're going to be more prepared. When you come back in here, you already know how to get the muscles working and firing. But you know, once you get to that point, you do have to have surgery. But I have a grade 3, and I've had that since it was 2, and then it went to 3, you know, between 2006 and 2007. And I manage it because if you can teach women how to maneuver throughout everyday life, and I still exercise, and I do high impact exercise at times. And so a lot of women just feel like, well, they're kind of told a lot of times that they can no longer do crunches and they no longer can do a high impact exercise with prolapse. But if you train people, like Julia was saying, which is what we believe, we train them within the tasks that they're doing. Oftentimes you can do so much with prolapse.
Thank you so much for explaining that. One of the tougher questions for a lot of moms, especially right now, here we are in the middle of a national crisis, and money can be tight, and there's so much going on around us. Is this something that's covered by insurance, or is this a for-fee service? And if it is a for-fee service, why?
All right, so I'll start off by taking that just because I opened the practice, and I chose to go out into a fee-for-service model, which means that clients pay directly for the services when they come and see Julie and I. We are considered an out-of-network facility. And I specifically chose to do that because what I was seeing over the years of practice was that more people were having high deductibles. We would always, at the insurance-driven facilities, we would always call and verify the insurance, and oftentimes they would say, yeah, it's covered. And then what would happen is the patient would get most of the way through their physical therapy plan of care, which is usually 6 to 8 sessions, and then they would get a huge bill for $2,000 or $3,000 because the insurance comes back on the other end and says, well, we pay for that diagnosis code, but we don't pay for these treatment codes. So then the patient is stuck at that point. And I really feel like as a consumer, when I go somewhere, I should be able to ask someone, what is my bill going to be? And they should be able to give me an answer, but they can't. And so because I was in management for so long and for different companies before I opened my own company, I know that in a hospital-based system in Indiana, an hour of physical therapy is between $700 and $750 an hour. Okay, these big box physical therapy companies are between $400 to $450 an hour. And the insurance usually only adjusts off about 30 to 35%. So these people are paying a crazy amount of money per session. Oftentimes they're only getting 30 to 45 minutes per session. And a lot of times they're being handed off to a therapy aide who typically has no education. Those people are usually trying to get into physical therapy school to do exercises. And it's my belief, and I know it's Julia's belief, that when people come in to see us, they're going to see a doctor of physical therapy one-on-one the entire time. Most people are afraid to come to pelvic PT because they think of this big, wide open therapy gym with a lot of people running around. Our clinic is just Julia and I. It's the two of us. We have private treatment rooms. It's very boutique-like, and it's very calming, and it's set up to be that way so that when women come in, they can relax and they can learn, and it can be about them and learning. And Julia had an experience with pelvic PT that I would like her to share, because it actually highlights why I chose to go out into a cash-based model.
Yeah, so I was dealing with a hip injury myself, and I worked at one of our local hospitals, and I chose to see an in-network provider because we really don't see what our patients are getting billed when you work in a hospital system unless you ask. Like you understand what it could be charged, but you really don't know. And so I was like, oh, well, I'm going to in-network. They must be giving me at least a solid discount, even though I have this high deductible plan. And so I went in. They were unable to tell me, even if it was my own hospital that was paying for it, to tell me what I was going to get charged. I didn't see a bill for probably 2 months. And then at that point in time, I realized I was paying $383 per session for 40 minutes of physical therapy. And after about 5 visits, I was like, I just can't do this anymore. And I reached out to Amy, which is how I got to know Amy better. And I asked for her prices. And I was like, oh my goodness, like this is so overwhelmingly better for me to be able to pay out of pocket, since I know I'm not going to meet my deductible. But as soon as you tell people that and make them understand, it's like, oh, it is actually a much more cost-effective route if you have a high deductible plan. And face it, most of us these days do have a high deductible plan, unfortunately. And so that's why, I came to join Amy, because I can physically tell each and every patient exactly what they're going to be billed for. They know they're paying it up front and aren't going to be slapped with an almost $2,000 bill 2 months later, like I was, and being able to deal with that. So I love being able to be transparent with my patients and being able to charge a fee that I actually am proud of.
Thank you for explaining that to us. I love your heart, ladies. I love how you just have a sincere passion to get the word out for mamas, and even those that are not yet mamas but are planning on becoming mamas, to take care of their pelvis and to get that assessment and to make sure they're shored up and ready for the next stage of life. So thank you so much for that. And one of the things that you've spoken about quite a bit is how important exercise is. And so exercise is so very important for us as adults. We need exercise to stay healthy. However, exercise is also important for that infant baby when that infant is born, right? So here we are taking care of mama. Now mama, if all goes well, will give birth or will choose to adopt a baby. Okay, now they have a new baby at home. What do? How do we take care of this baby? And just like we want to make sure we're taking care of ourselves, we also want to set our babies up for the best possible success, right? We can't guarantee anything, but one of the things that babies need to do from the very, very, very beginning is exercise. And so the way they get this exercise is through this process called the infant developmental sequence. And so I'm going to take about 5 minutes now just to explain about the infant developmental sequence. And then we're going to come back and finish up with Dr. Amy and Dr. Julia and ask a couple more questions. So for those who are on tonight, while I'm getting everything set up here to just talk a little bit about the infant developmental sequence, I'd just like you to go ahead and feel free to add some questions in the chat box here. So here we go. The infant developmental sequence. I am going to share my screen and let's see. Here we go. Okay, so let's do this and let's do that. Now, can you see the presentation? And can you hear me okay?
Yes.
Awesome. Technology is working for us today, right? Doesn't always happen that way. And so let's go ahead and dive in and talk about the infant developmental sequence, okay? As I've already shared with you earlier at the beginning, my name is Jocelyn Williams, and I am the founder and director of Neurolly Solutions Incorporated. And Neurolly provides movement. I'm gonna move this out of the way. Provides a movement-based educational approach to equipping the infant brain for life. Okay. The work of Neurolly is based on the infant developmental sequence. Every human infant was designed to go through a simple process, okay? And this simple process, in essence, equips the foundational levels of the brain, okay? This part of the brain, the foundational levels of the brain, are responsible for all of our automatic functions, for things such as bonding, emotional regulation, focus, sensory processing, and so much more, okay? The developmental sequence for infants is as simple as A, B, and C. But what's important to note is that this developmental sequence needs to occur before the baby starts walking. The infant developmental sequence in its entirety includes three major components: patterns, sensory integration, and movement. For time's sake, today we're just going to focus on the movement piece of it, okay? So let's go ahead and begin, okay? From birth, babies need to be on their tummies approximately 50% of a 24-hour period. We call this tummy all the time. It's important to note that 10 minutes of tummy time is not enough tummy time. Babies need to be on their tummies. Why? Because when they're on their tummies, guess what they're doing? They are exercising. They're exercising their physical bodies. But more importantly, they are exercising the brain, those lower foundations. Because you know what? The lower foundations of the brain, you cannot develop those logically. Okay? You have to. Good night, son. I love you too. So that was my son saying good night to mommy. And we're all about babies and children, and I love my kiddos. Okay, so the that foundational part of the brain, we can't develop it through logic. For example, I can't tell the infant brain, hey, little baby, when you're 16, these are the things that you need to do so that you don't feel anxious, okay? No. That doesn't make sense at all. What that infant brain needs is movement, which is exercise, okay, the sensory integration, and the patterns. So they need to be in their tummies approximately 50% of a 24-hour period. Next, B, tummy all the time will lead to tummy crawling. Now notice the position of the baby. The baby's belly is flat on the ground and the baby is moving forward. This form of locomotion is similar to an army crawl. Okay, it's not exact. And here's a little tip. If a baby doesn't need mittens, they do not need socks. So I want to encourage you, strip your baby down. All they need is a onesie and a diaper, and the floor should be nice and clean and safe. Of course, you can put a mat, something that they can grip really good on. You can put a nice comfy mat on your floor and just put them on the floor. So you're gonna pick them up, put them down, pick them up, put them down, and eventually that tummy all the time is going to lead into this process called tummy crawling. The next step is hands and knees creeping. So at approximately 6 to 12 months, babies need an ample amount of time to creep on their hands and knees. Now notice the position of the baby. The baby is up on all fours and the belly button is no longer touching the ground. Babies should continue creeping until their creep has developed into an efficient cross-lateral movement. So, as I stated just a few moments ago, the developmental sequence is what is needed to equip the brain for life. When an infant engages in the developmental sequence, they are given equal access and opportunity for things such as bonding. A child who is socially, emotionally equipped to have healthy peer interaction. A student who is able to learn well. And an adult who has the strength needed to make a positive global impact. So in summary, the developmental sequence for infants is as simple as A, tummy all the time, B, belly button flat on the ground, and C for creeping, hands and knees creeping. And let's remember that all of this movement, sensory input, and patterning needs to happen before the baby walks. Why is the infant developmental sequence so effective? It is my belief that it is so effective because it is not a man-made program. It's not something that I came up with or somebody else came up with. This was a process that researchers observed babies all around the world doing, okay, no matter where that baby was, no matter what their economic status was. They could be in Alaska, they could be in Africa, they could be in the United States. All babies, when given the opportunity, okay, and of course, if they don't have any other organic complications, okay, they should naturally go through this process when given the opportunity. So this is not a man-made program. This is how babies were designed to equip their brain for life, okay? So who do we work with? We work with infants, we work with children, students, and adults, okay? Our process is super simple. We set up either a video assessment or a one-on-one in-person consultation using safe protocols, okay? We then, after the assessment, have a training time. So the primary caretaker is provided training in the elements of the developmental sequence. Then the primary caretaker will be given a daily movement plan and the support protocols needed to ensure that the baby has equal access and opportunity to complete the infant developmental sequence, okay? For older children, for students, for adults, we actually replicate the developmental sequence, and this pathway is called neurodevelopmental movement. And this is all based on neuroplasticity because when given the right triggers, the brain is able to change. In other words, there is hope. There is a second chance, and it is amazing to watch children come into my office who are just profoundly struggling, go through the infant developmental sequence, go through the parts and the pieces that they missed when they were infant. We replicate it, we redo it, okay? And it's astonishing what happens. We had one little boy, he just simply could not read. We took him through this process, and in less than a year, he's reading. Another little guy came in. This is a true story, okay? Leandra can attest to this. True story. Little boy, his hips were popping out. Mom had to literally replace the hip several times a day. Took this baby through the neurodevelopmental movement. So he's not a baby. He was already about 8 years old. We took him through neurodevelopmental movement, and guess what? They canceled surgery. He does not have to have a hip replacement, okay? Hip surgery. I don't know if it was hip replacement, but he doesn't have to have hip surgery because his hips are now working, okay? To learn more about the infant developmental sequence or neurodevelopmental movement, please get in contact with me. My name is Jocelyn Williams. My phone number is 317-936-7666. 6797. My email is jwilliams@nsibrain.com. And of course, you can find me on social media at Neurolly Solutions. So please remember, so important, babies need lots of movement. Just like we as adults need exercise, and we were just talking about that with Dr. Julia and Dr. Amy, our babies need movement and exercise from infancy. So thank you for taking a moment to listen to that. We're gonna go back over to Amy and to Julia. Welcome back. And so we've got some questions that popped up, and I'm going to present them to you, okay? If someone would like to talk more with you to figure out if they can work with you during their pregnancy, how soon would they need to contact you?
So people can contact us at any time. The one thing that we do tell people is don't wait until the last minute, because depending on the time of year, sometimes it takes anywhere between 6 and 10 to 12 weeks to get an appointment with us. And so if it's preconception, really any time is good, but we like people to kind of be ahead of the curve just a little bit. You know, it's easier for us to, know that we may have 3 or 4 visits before someone gets pregnant. Because we do not do internal pelvic assessments in the first trimester, unless there's something else going on that the physician, says, yes, we need you to do that. But typically, if they think they may be pregnant, there's a potential they could be pregnant, we would never do a pelvic assessment. And for anyone who's struggling with fertility issues, that's something that we actually do have people track, if they're trying to conceive, because if we're working on those female organs, and there's a potential they could be pregnant, it could cause a miscarriage. So we wouldn't do that either. So we like for people, if they can, to try to get in, at least a couple months before they start prepping. That's not always possible, and we'll see people whenever, but it may change the way in which we do an assessment.
Here's another question. If we have a teenager who, obviously we want to avoid any potential for pregnancy at all as a teenager. But eventually that young lady, our hope and goal is for them to have a family in the future, and they may choose to get married and want to conceive. What signs should I be looking for when that teenager is having their cycle, their monthly cycle? What are some signs that could tell me, there might be a problem in the future? I should probably get a pelvic PT because I want to set this young lady up for her to be able to fulfill her dream.
Sure. I'll go ahead and take that one because obviously you both kind of know some of my background. One of the big things for teenagers who have their period is very painful periods. If girls are having very, very painful periods, it can either be a sign of endometriosis, a sign of PCOS. There could be other things going on as well, but if it is a teenager who has never been sexually active, as a pelvic PT, we wouldn't do a pelvic assessment. We would do all external work unless the mother and the teenager request specifically that an exam is done. Now, in that case, I always make sure they have seen an OBGYN first, where they've done that assessment. I, as a PT, would never do that first initial assessment. But we really do look at if girls are having very painful periods, they're missing school, they're missing athletics, they're asking for medicines every month. That is a sign that there are some other things going on. And very often, pelvic PTs can help. And I will just tell you that that is not something that most physicians will share with you. A lot of them don't even know that pelvic PTs can help with it. Usually the first line of defense is birth control. And I know, Julie and I both have a similar experience with birth control and the use of birth control, but birth control can have so many other effects on a young girl that aren't really shared with the young girl and the mother. It can affect the ability to conceive down the road. Sometimes when girls have endometriosis, you do actually have to meet with a physician who is a specialist in endometriosis. Unfortunately, in Indiana, we don't have any or none yet that I'm aware of. Because sometimes young girls do need to be placed on birth control, but it's a very specific kind. And the mom and the daughter have to understand that that doesn't stop the disease from progressing. And it's a very important conversation to have because it can affect fertility down the road. But there are lots of things that a pelvic PT can do to help keep the organs moving and help keep that pain response down. And your true endometriosis specialist actually require people to see pelvic PTs because you want to keep the pain response down, to keep the nervous system in a more calm state. And so pelvic PT can help with a lot of those things, but pain is the biggest indicator. If they're having pain over and over and over again every month, where they're especially missing things, they need to be assessed. It's very important.
Thank you for addressing that. I think that's very crucial. So let's go back to, so we've got a healthy young woman who's now grown up, ready to have a baby, okay? If this woman now, okay, is pregnant, is it too late to have a pelvic PT, or do you just look at them differently? Since you don't do an internal, what do they do now?
Yeah, so 100%, it is always good to see a pelvic floor PT when you're pregnant. It is never too late. What Amy was talking about was if you wanted to do a preconception visit to assess your pelvic floor internally first to see what it's like before getting pregnant. Once you conceive in those first 3 months, we don't do an internal assessment. After those 3 months, we definitely can. And in general, we do, but we can also in those first 3 months assess things externally as well. And so if you do come to see us in those first 3 months, there are things that we can assess externally to make sure pelvic floor wise things are good, but then your whole body can be assessed. We can assess your posture and your breathing mechanics, what all of your muscle strength is like externally. And then once we get a chance to, we can assess that pelvic floor internally again after 3 months.
Those are some great questions. Ladies, it has been an honor and a privilege to have you on as a guest speaker tonight on our Indie Birth Alliance Summer 2020 Education Series. Thank you for just volunteering your professional time to share this very important and vital information with us. I am all about let's get the word out. There are so many things that we can do to help set our little babies up for success, right? We help mom, we support mom through that pregnancy period, preconception, even as a young lady, get her all set up, and then this precious baby comes into the world, and then we want to do our very best to care for that child. Thank you for being amongst those that advocate and educate and support the birth community. Before we close out, is there one special thing that you want us to leave tonight with? Like, what's that little golden nugget? If we missed everything, what do you want us to hear before we end?
I think it's important for every woman to understand that every woman should have a pelvic floor assessment, preconception. They should be able to have therapy during their pregnancy and then postpartum. So it's important throughout the pregnancy that women be checked so that, you know, they're healthy and that their babies are healthy and that they're prepped for delivery and that they're healthy in the postpartum period, because there are so many things that women are living with that they absolutely do not have to. Julia, do you want to tag on to that?
Yeah, so on the opposite end of that is that it's never too late. And that, yes, we can help in that time period, but if you're years after having your baby and you're still having issues, there is always hope. Our bodies are resilient and they are strong, and there is hope to take care of your symptoms, and you need to be doing the things you love, and there's no reason not to. And that's Amy and I's goal, is to get our moms and women in our community back to doing the things they love to be able to take care of their families.
I love that. That is so encouraging. Thank you so, so much. Well, that concludes tonight's session. However, I want to draw your attention to the fact that next week our speaker will be Jamie Fione. And Jamie serves mothers during pregnancy and postpartum to have an empowering and comforting birth postpartum experience. And catch this. I mean, this is perfect timing. We didn't even plan it this way. She is a beach body coach, and she encourages postpartum moms to take care of themselves with nutrition and fitness. Isn't that awesome?
Yes.
So we've got pelvic PT, and then we get who are there to help us get back into exercising, and then Jamie, who come alongside us and make sure that we're taking good care of our bodies with nutrition and exercise. So I'm excited for next week's event, next week's webinar with Jamie Fione. To register for next week's event, for those of you who are participating tonight, you can just click on the link in the chat. And for those of you who are watching this recording, thank you for joining us. And thank you for watching the recording. If you'd like to join us next week, I believe it's September. It's actually in 2 weeks because next week is Labor Day weekend. So it will be the 14th. So we're going to take off for Labor Day weekend. Everybody take a little rest. We're going to start up again September 14th, 2020 at 8 p.m. Eastern Standard Time. And to register for our event, just go to Eventbrite and go into the search and type in Indie Birth Alliance Summer 2020 Education Series. Even if you don't get all of that, you just type in Indie Birth Alliance, I'm sure it will pop up. And we're looking forward to seeing you in 2 weeks. So just remember, not next week, we're gonna take off for Labor Day weekend and we'll hop back on September 14th. Thank you again for participating. My name is Jocelyn Williams. I am a developmental movement consultant, and I am the founder and director of Neurolly Solutions. It's been an honor to be your host tonight. Have a good night, everybody.
Good night.